Hi everyone, welcome back to my channel where we explore global issues through the lens of inclusion, equity, and empowerment. And if you're new here, hit that subscribe button and let's dive into today's topic. And today's topic, can you guess what it is? Can you guess? Can you think? So today we are looking into disability and mental health in Africa. We're bringing it down to Africa, okay? So somebody can say, why Africa? So then, why is this conversation matters, or why is this conversation important? When you talk about disability and mental health, they are often treated as separate issues, but in reality, they are deeply interconnected. In Africa, the overlapping presents unique challenges shaped by cultural beliefs, limited resources, and systemic neglect. Today, we are unpacking how disability and mental health intersect, what barriers exist, and what can be done to support millions of people across the continent. So now we are looking at the overlap. Where did they have the thin line between disability and the mental health? So now we're looking at disability and mental health can influence each other, excuse me, in a powerful way. It can influence each other in a very, very powerful way. People with physical disability may experience depression or anxiety due to stigma, isolation, or lack of access. This is true. There's a lot of depression, anxiety among persons with disability. We are stigmatized, we are unemployed, we don't know how we are going to move with life, and all these things true. Many of us with very deep depression and anxiety. Mental health conditions like schizophrenia or bipolar disorder can lead to functional impairments, which are often classified as disabilities. So I can call it invisible disabilities. Are you seeing the overlapping? The biophysiosocial model. And so many people are not conversant with psychosocials. But now this is the biopsychosocial model, which considers biological, psychological, and social factors, is key to understanding these complex relationships. You can see some people are psychosocials. It's also kind of some level of disabilities. It's a new one that I'm learning recently, but has been in existence. So what are the challenges in Africa? Without not being told, the challenges we face in Africa is stigma and cultural beliefs. Mental illness is often misunderstood and linked to witchcraft or spiritual punishment in some communities. I'll tell you, I went for one meeting like that for a person with disability, and a young girl shared a very disheartening life experience. Because she's a person with disability, they say she's a witch. Not only that she's a witch, the parents or the mother took her to some of all these false prophets or churches where they did all kinds of disgusting things that I won't be able to mention here. Very dehumanizing, coupled with part of sexual harassment and all that, because she's a person with disability. The stigma and the cultural belief, she's a witch, they're going to do spiritual cleansing and all that kind of nonsense rubbish. People with disability are frequently seen as cost or less than, and this is leading to social exclusions. They will look at you, who are you? What can you offer? A person with disability. That's the challenges. And African lose a lot of intelligent people among persons with disability that can contribute and help move the nation forward. Okay, then another challenges in Africa is underfunded healthcare systems. As a person with disability in Africa, you are not employed. Which health system will take care of you? None, except very few NGOs that are into healthcare, that if you're opportuned, you'll be under their what? Their healthcare system. And one of the healthcare system in Nigeria that caters for the minorities, for persons with disability, is Miss Minor Foundation. They are very, very, very efficient and inclusive when it comes to what? Health with persons with disability. So Miss Minor Foundation, well done for your great work, and only God will bless you for what you are doing. So most African governments spend less than 50% per capita on mental health, far below the recommended $2. You're supposed to spend $2, but you're spending 50 cents. That's a challenge we face what in Africa. This leads to inadequate services, few trained professionals, and poor infrastructure. Underfunded healthcare system is killing persons with disability. I won't tell you the number of persons with disability that have died. And one of the causes is what? Lack of what? Health care. No money, no fund. They are sick in the house, they can't go to hospital. No fund. They are not employed. If you're employed, probably the office can have health care for you. But when you're not employed like me, oh my goodness, forget this fine face. We don't look like what we've gone through. It's not that so easy. Okay, so inadequate services, trained professionals, poor infrastructures are challenges that we are facing in Africa. The one of other challenges is limited access to care. Whenever we talk about care, sometimes you look at only people in urban areas. How about the people in rural areas? Most people travel long distance for treatment, often without reliable transport. Because people in urban areas, it's not easy for them to access care in the city. And many turn to traditional or religious healer due to lack of formal services. They go there just to try luck. And when you come to person with disability, those are just very funny places to be. Then we'll look at lack of data and visibility. Disability and mental health care are often missing from national health system, making it hard to plan effective intervention. Yes. It's recently that we start concentrating about mental health. Before, we don't look at it, we don't consider it in healthcare. If you are having a mental health care, you're on your own. You just crazy and die. But I'm glad today it's been considered, even though it's still one of the problems, but it has been identified to be part of it. And again, look at gender and age disparities. Women face higher rates of disabilities due to domestic violence, poor maternal care, and social inequalities. That's why I always say that women and children with persons with disability, let's look at what can be done for them to improve their life system and everything they do. So, gender age disparities is still the challenges we face in Africa. Older adults experience compounded challenges with mobility, hearing, and mental health. The question we ask today: I'm a young person with disability. In next 10 years, in next 20 years, if I'm still a person with disability, how am I going to cope? You see what it's called? It's a compounded challenges. Some things I am able to do for myself now. When I'm older, will I be able to do that for myself? How am I going to cope? How am I going to survive? How am I going to live? Then we're going to move to next one. Remember, my name is Monica. Really continue watching. Today we are looking at mental health and disability, how they are overlapping. So what are we going to do? What's being done? There are some promising factors. Organizations, there's been some organizations like Strong Minds are scaling up group talk therapy for depression in Uganda and Zambia. And we also have some in Nigeria. There is one lady, she has written a book about mental health, which is really impressive. Then looking at the World Health Organization endorses interpersonal psychotherapy as a cost-effective solution in low-resource setting. Researchers and advocates are pushing for biopsychosocial approaches that integrate mental health into disability care. That's a good one. So, what are we going to do next? Let's hear from you. Have you had someone you know face challenges with disability and mental health in Africa, in Nigeria, in Uganda, in Zambia, in Togo, in Benin Republic, in Chad? What helped and what didn't? Drop your story in comments. I want to hear your voice. Call to action. If you believe in breaking stigma and building an inclusive system, give this video a thumbs up and share it with your network. And let's keep pushing for change. Subscribe for more videos on disability rights, mental health, social justice across the globe. Thanks for watching, fam, and remember, mental health is health, disability is diversity, and inclusion is non-negotiable. Stay kind, stay curious, and keep advocating for a better world like me. Thanks for watching, and bye for now.